right, here we go. Today we're going to discuss outpatient joint replacement surgery. And wow, joint replacement surgery has come a long way in a relatively short period of time. It really wasn't that long ago that joint replacement surgery involved an extended hospital stay, maybe some bed rest, maybe even a stint in a nursing home after surgery. But those days are behind us, and that's for the good. It turns out that the faster we get our rehab going, the less complications we have, the better our recovery, and the better our ultimate outcome is. This video is going to discuss why that change in philosophy, what the benefits of outpatient surgery are, who aren't the best candidates for that, who is a good candidate for that, and why, if you are a candidate, you should strongly be looking into it. Stay tuned. Welcome back. I'm Dr. Dan Tomaszewski, orthopedic surgeon at the Door Orthopedic Center at Door County Medical Center. And I'm laughing a little bit because I'm just imagining somebody on the other end of this screen thinking, are you crazy? Outpatient joint replacement surgery? I know what joint replacement surgery is. There's no way you could do that as an outpatient. Is it like a drive-through now? You just stick your arm or your leg out the window? And it's really not like that exactly. Although there are a lot of similarities between the development of maybe a drive-through at a restaurant to what outpatient surgery is. And bear with me on this a little bit. The first person who had the idea of doing a drive-through restaurant really had to do a lot of work to make that happen, right? They had to do a lot of work in planning, building the drive-through, educating people that that was a possibility, that you could actually go through a drive-through to get your meal for the day. You had to educate the customers about your menu and the prices and the process, right? If you didn't know about the process, it wasn't really going to work well. You had to have great communication. You had to have that intercom, right, that you could talk to and get a person on the other end and know that that communication was happening well, that your order was getting transmitted to the right person. You also had to have a reproducible service, right? You wanted to make sure that when you went through the drive-through and you talked through that intercom, you actually got what you ordered and you paid the right price. Those were very important details. Of course, to make that all happen, you had to have well-trained staff. You had to have people who were efficient and knew what they were doing and could do things fast. But most importantly, you couldn't sacrifice quality. You couldn't sacrifice safety for the sake of a fast service, right? You had to make sure that your hamburgers were cooked well through. And all of those parts of making that drive-through service possible are kind of similar. There's an analogy there to what we're doing with outpatient surgery. Of course, it's not the same as a drive-through, but you have to have well-trained staff. You have to have great communication. You have to have great infrastructure. You have to educate people, prepare people for that. You have to have fast but reproducible services. All of those pieces of the puzzle are critical. You can't be missing one of those. It's just like the drive-through. If everything was in place, but that intercom wasn't working, everything falls apart. And so all those pieces have to be in place for this to work. And there are some absolute keys to success for outpatient surgery, for this to work, because the process is valuable. As I mentioned earlier in the introduction, there are many benefits of outpatient surgery. It turns out the longer we spend in the hospital, the higher our risk of complications like infection, blood clot, and stiffness. And so we want to try to limit those risks. Outpatient surgery does the best possible job of doing that because you can't spend any less time in the hospital than no time, right? You just keep moving on with your life. But the benefits don't stop at the decreased complication rate. It turns out the faster you get moving with your recovery, the better your ultimate outcome. And I'm talking 5 years after surgery. If you get moving faster, right away, day of surgery, people who rehab the fastest do the best. And it kind of makes sense. If you don't take time to have your muscles get weak and stiff and atrophied, if you keep moving with your life, the better your ultimate outcome because there's no downtime. You're not battling against all that stiffness and all that weakness that we impart by just kind of laying around. So it's really important to get moving fast for not only your early recovery, but for your ultimate outcome. But of course, outpatient surgery is not for everyone or every institution. Again, I mentioned you have to have all those pieces in place to make it work, but also you have to have the right patient. It's not meant for the very elderly people or the people with certain medical comorbidities, medical problems that would preclude us from being able to do this surgery as an outpatient safely. You also need to have a good network at home, whether it's friends or neighbors or relatives that can help you in a pinch. All of those things are important from a patient side to make sure that we have those pieces in place for a successful outcome. But from a doctor side of things, right, from the hospital side of things, we also have to have many different things in place, sort of keys for success. And those start way before surgery. It starts with making sure that you're medically well before surgery, making sure your blood pressure is in good order. If you're a diabetic, that your blood sugars are under good control, making sure all the cards are in your favor for a good outcome, making sure that we're going to limit complications. In addition, before surgery, we also have people go to an educational class where we can teach you what to expect. Things are much easier if you know what to expect every step along the way. And that starts from before surgery, through this surgical process, the day of surgery, that afternoon after surgery, when you go home, and even the days and weeks after surgery. If you know what to expect, if there aren't any surprises, there's not as much anxiety about it. There's not as much worry about it. Of course, even beyond the preparation part of it, the surgery itself, the day of the surgery, has to go just right. People who are having outpatient surgery really benefit from having their surgery early in the day, for instance. That gives us the most possible time to get you recovered, wake you up, get you through rehab, and get you home safely without feeling like you're rushed out the door. That's never the goal. We're never pushing somebody out the door to get them home the same day. It's getting you home, but getting you home safely and confidently. So early surgery makes a big difference for that. In addition, making sure that we do the right anesthesia. Anesthesia for outpatient surgery is best done in a regional fashion, like a spinal anesthetic. If we put a tube down your throat and we put you to sleep, well, you wake up after that surgery in lots of pain because there's nothing to numb up your leg or your arm, and you wake up groggy and kind of hung over from all that medication that you had. And so the more regional anesthesia that we can do, a block for your shoulder or a spinal anesthetic for your legs, the less medical anesthesia that we have to give you, the less medicines we have to give you that can really have all those bad side effects. And so regional anesthesia is really the way to go. And fortunately, it turns out that that's the safest type of anesthesia. Again, the less anesthetic medications we give you, the less medicines that the anesthesiologist gives you, the less side effects you get. And so that's really a win-win situation for folks. Now, what about the surgery itself? It's really important as a surgeon to limit the amount of trauma during the surgery. You want to make this as comfortable as possible. You don't want to do a lot of muscle damage. You don't want to do a lot of tugging and pulling that's going to cause more swelling, more bruising, more pain. And so minimally invasive surgery, for the most part, is really important. But of course, just like with that drive-through, you can't sacrifice quality for speed or for a small incision. It's got to be done well, but with a minimum of trauma. Now, after surgery, immediately after surgery, after you kind of wake up from the anesthesia and the numbing medicine wears off, early therapy is critical. Again, that's one of the keys. It's making sure that we get you moving as soon as possible so that this surgery is not a big detour in your life, but it's really just a little bump in the road. We want to get you back to your life as soon as possible. Remember, after surgery, it can hurt, it can be stiff and swollen, but you're not sick. You're well, you're healthy, and you're getting better. You're doing this for a good reason, to get you your quality of life back. And so you gotta grab it, you gotta go after it. And early rehab is really getting you on the road to doing that as soon as possible. Now, what about medications? Now, there are many medications that we use throughout the whole process, and that starts in the operating room. There are medications that we use that can limit blood loss. You know, the more blood that you lose, the more lazy you feel, less energy that you have. And we don't want that, right? We want you to get back up on your feet and get moving. And so we want to try to limit the blood loss as best we can. We also use medications around your joint, kind of numbing medicines that make it a little bit more comfortable for you so it's not as sore as it used to be with surgeries in years gone by. Now, after surgery, we try to manage pain from multiple different angles. We use medications to help with inflammation and nerve pain and light pain medications, stronger pain medications. All of those things can attack pain from different angles. That makes it a little bit more comfortable, a little bit more manageable for you. Now, putting all those pieces together between early education, getting you medically optimized for surgery, regional anesthesia, using the right medications around surgery, early rehab, all those pieces are critical to make this happen. But if you can get all those stars to align, outpatient surgery really has great benefits to limit your chances of complication, to improve your early recovery, and to improve your ultimate outcome. And so if you are a candidate for it, you should really strongly think about pursuing that. Okay, so that's outpatient surgery in a nutshell. All the benefits of it, what the process looks like, but you may have other questions about it. Am I a candidate for it? Is it the right answer for me? What does that process look like? If you have any questions about outpatient joint replacement surgery, don't hesitate to contact us. That's what we're here for. We always love hearing from you. Again, I hope this has been helpful for you, and thanks for watching.